Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're new to my channel, I just want to apologise for the other upfront of the all about Alzheimer's at present, because at this point of time I believe that I should have actually pre-warned you that maybe I should break them into parts, since some of this part, especially as well as these other parts of the health in general, I want to talk about of the chronic illnesses especially, should be broken down into small parts so it's easier for you to follow. So my fault on that front, so I humbly apologise. But if you're following me right now anyway, I'm going to just break it down to you that it's hopefully just two parts, which will mean that this part will be based on for the all about Alzheimer's, the treatments. So before I begin this, as always, as a disclaimer, I'm no medical doctor, so if you see any warning signs and symptoms in regards to any of these topics, please seek professional help for yourself or your loved one, or even second opinion, regardless what this may be, because I don't forever condone anyone to do self-harm. So let's begin this before we run out of time. So for the treatments of Alzheimer's disease, basically, as we know, like many other conditions, there are currently no cure for Alzheimer's or mental health, he say, as an example, but bear in mind though that it is manageable, and like the clinicians recommend basically that drug and non-drug treatments may help with both cognitive and behavioural symptoms. Researchers are looking for new treatments every day to alter the course of this disease and hopefully improving the quality of life for people with dementia. As I said before, Alzheimer's is a form of a dementia, obviously, and we need to bear in mind. Just bear in mind also some statistics, as well as some of the information I'm gathering right now, is basically all about the US, which I was trying to look for some in New Zealand as well. So, although current medications cannot, like I said, so therefore, cannot cure Alzheimer's or stop it from progressing, they may help lessen the symptoms, such as memory loss and confusion for a limited time. The types of drugs. The US Food and Drug Administration, or FDA, has approved two types of medications. Cholinesterase inhibitors, which are your clinical ones, Aricept, Exelon, Razidine, and Memantine, Namenda, to treat the cognitive symptoms, memory loss, confusion, and problems with thinking and reasoning of Alzheimer's disease. As Alzheimer's, however, progresses, brain cells do die and connections among the cells are lost, causing cognitive symptoms to worsen over time. While current medications cannot stop the damage of Alzheimer's or causes to brain cells, they may help lessen or stabilise symptoms for a limited time for affecting certain chemicals involved in carrying messages among the brain nerve cells. Doctors sometimes prescribe both types of medications together. Some doctors also prescribe high doses of vitamin E for cognitive changes of Alzheimer's disease. Medications for earlier to moderate stages. All of the prescription medications currently approved to treat Alzheimer's symptoms in early to moderate stages are from a class of drugs called cholinesterase inhibitors that I just mentioned. Cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. The cholinesterase inhibitors medication safety. Before beginning a new medication of any form, make sure your physician and pharmacist are aware of all medications that you are currently taking, including over-the-counter and alternative preparations. This is important to make certain that the medications will not interact with one another, causing side effects. Prevent the breakdown of acetylcholine, a chemical messenger important for learning and memory. This supports communication among nerve cells by keeping acetylcholine levels high. Delay worsening of symptoms for 6 to 12 months, on average for about half the people who take them, are generally well tolerated. If side effects do occur, however, they'll commonly include nausea, vomiting, loss of appetite, increased frequency of bowel movements. Basically, do seek professional help again. 3 cholinesterase inhibitors are commonly prescribed. Donazepam, Aricept, is approved to treat all stages of Alzheimer's. Rivastigmine or Exelon is approved to treat mild to moderate Alzheimer's, and galantamine Razidine is approved to treat mild to moderate Alzheimer's. Okay, another one is medication for moderate to severe stages. A second type of medication, Memantine Namenda, is approved by the FDA for treatment of moderate to severe Alzheimer's. Memantine is prescribed to improve memory, attention, reason, language, and ability to perform simple tasks. It can be used alone or with other Alzheimer's disease treatments. There is some evidence that individuals with moderate to severe Alzheimer's who are taking this form of drug of cholesterol inhibitor might benefit by also taking memanotide. Donazepam, Aripiprazole, is the only cholesterol inhibitor approved to treat all stages of Alzheimer's disease, including moderate to severe. Just a brief note of what memanotide do. This regulates the activity of glutamate, a different messenger chemical involved in the learning and memory of the brain. Delays worsening of symptoms for some people may be temporary. Many experts consider its benefits similar to those of cholesterol inhibitors. Can cause side effects which would include the headache, constipation, confusion, and dizziness. Tomorrow's treatments. Ultimately, the path to effective new treatments is through clinical trials. Trials are recruiting people with Alzheimer's and mild cognitive impairment, or MCI, as well as some healthy volunteers to be controls. Treatments for behaviour. Common changes in behaviour. Many people find the changes in behaviour caused by Alzheimer's to be the most challenging and distressing effect of this disease. The chief cause of behavioural symptoms is the progressive deterioration of the brain cells. However, as said before, medication, environmental influences, and some medical conditions also can cause symptoms or make them worse. In early stages, people may experience behaviour and personality challenges such as irritability, anxiety, depression. In later stages, other symptoms may appear, including anger, agitation, aggression, general emotion distress, physical or verbal outbursts, restlessness, pacing, shredding paper or tissues, hallucinations, delusions, sleep disturbance. Triggering situations. Events or changes in a person's surroundings often play a key role in triggering behavioural symptoms. Changes can be stressful for anyone, and can be especially difficult for the ones that suffers from Alzheimer's. It can increase the fear and fatigue of trying to make sense out of an increasingly confusing world. The situations that may affect the behaviour may include moving to a new residence or nursing home, changes in a familiar environment or caregiver arrangements, misperceived threats, admission to a hospital, being asked to bathe or change clothes. Identifying what has triggered a behaviour can often help in selecting this to best approach and deal with this. Dementia can cause unpredictable behaviours due to changes in a person's brain. Medical evaluation for contributing factors. Everyone who develops behaviour changes should receive a thorough medical evaluation, especially if symptoms appear suddenly. Even though the chief cause of behavioural symptoms is the effect of Alzheimer's disease on the brain, examination may reveal other treatable conditions that are contributing to the behaviour. Contributing conditions may include difficulty with communication. Because people with Alzheimer's gradually lose the ability to communicate, it is important to regularly monitor their comfort and anticipate to their needs. Drug side effects. Many people with Alzheimer's may take prescription medication for other health issues besides Alzheimer's. Drug side effects or interaction among drugs can affect the behaviour. Discomfort from infections or other conditions. As the disease gets worse, those with Alzheimer's have increasing difficulty communicating with others about their experience. As a result, they may be unable to report symptoms of common illnesses. Pain from infections from the urinary tract, ear, or sinuses may lead to restlessness or agitation. Discomfort from a full bladder, constipation, or feeling too hot or too cold may also express through their behaviours. Uncorrected problems with hearing or vision. These can contribute to confusion and frustration and foster a sense of isolation. Non-drug approaches to managing behaviour symptoms promote physical and emotional comfort. Many of these strategies aims to identify and address needs that the person with Alzheimer's may have difficulty expressing as the disease progresses. Non-drug approaches should always be tried first. The steps to developing successful non-treatments include 1. Recognise that the person is not just acting out mean or ornery, but is having further symptoms of the progressing disease. 2. Identifying the cause and how the symptom may relate to the experience of the person with Alzheimer's. 3. Changing the environment to resolve challenges and obstacles to comfort and ease of mind. Coping tips. Monitor personal comfort. Check for pain, hunger, thirst, constipation, full bladder, fatigue, infections, and skin irritation. Maintain a comfortable room temperature. Avoid being confrontational or arguing about facts. For example, if a person expresses a wish to go to visit a parent who died years ago, don't point out that the parent is dead. Instead, say something like, "Your mother is a wonderful person. I would like to see her too." Read the other person's tension. To remain flexible, patient, and supportive by responding to the emotion, not just the behaviour. Create a calm environment. Avoid noise, glare, insecure space, and too much background distraction, including television. Allow adequate rest between stimulating events. Provide a security object. Acknowledge requests and respond to them. Look for reasons behind each behaviour. Consult a physician to identify any causes related to medications or illnesses. Explore various solutions. Don't take the behaviour personally and share experiences with others. Medications and behavioural symptoms. If non-drug approaches do fail after being applied consistently, introduce medications that may be appropriate for individuals with severe symptoms or have potential to harm themselves or others. While prescription medications can be effective in some situations, they must be used carefully and are most effective when combined with non-drug approaches. The following general principles can help guide appropriate use of medications. Know the risks and benefits. It's important to understand the potential benefits and risks of medication before making treatment decisions. Target a specific symptom. Effective treatment of one core symptom may help relieve other symptoms. For example, some antidepressants may help people sleep better. Start with a low dose of a single drug and monitor closely for side effects. Side effects can be serious and drugs can occasionally even worsen the symptom while being treated. So should not be increased without a careful evaluation by a healthcare professional. Medication examples. Some medications commonly used to treat behavioural and psychiatric symptoms of Alzheimer's disease. Listed here, what I'm doing, listed in alphabetical order by generic name, including the following: antidepressants for low mood and irritability: citalopram, Celexa, fluoxetine, Prozac, Paroxetine, Paxil, Sertraline, Zoloft, Trazodone, Desril, anxiolytics for anxiety, restlessness, verbally disruptive behavior, and resistance. This one is iozarapine, Ativan, oxazepam, Serax, antipsychotic medications for hallucinations, delusions, aggression, agitation, hostility, and uncooperativeness. Aripiprazole, Abilify, clozapine, Clozaril, haloperidol, Halodo, olanzapine, Zyprexa, quetiapine, Seroquel, risperidone, Risperdal, Ziperidone, Gideon. Antipsychotic medications. Decision to use an antipsychotic drug needs to be considered with an extreme caution. Research has shown that these drugs are associated with an increased risk of stroke and death in older adults with dementia. Based on scientific evidence as well as governmental warnings and guidance from care and oversight bodies, individuals with dementia should use antipsychotic medications only under one of the following conditions. 1. Behavioural symptoms are due to mania or psychosis. 2. The symptoms present are a danger to the person or others. 3. The person is experiencing inconsolable or persistent distress, a significant decline in function, of substantial difficulty receiving needed care. And 4. Antipsychotic medications should not be used to sedate or restrain persons with dementia. The minimum doses should be used for the minimum amount of time possible. Adverse side effects may require careful monitoring. Although antipsychotics are the most frequently used medication for agitation, some physicians may prescribe a seizure medication mood stabilizer such as carbamazepine, Trigatol. Treatments for sleep changes. People with Alzheimer's often have problems with sleeping or may experience changes in their sleep schedule. Scientists do not completely understand why these sleep disturbances occur, however. As with changes in memory and behaviour, sleep changes somehow result from the impact of Alzheimer's on the brain. When managing sleep changes, non-drug coping strategies should always be tried first. Common sleep changes. Many people with Alzheimer's experience changes in their sleep patterns. Scientists do not completely understand why this happens. As with changes in memory and behaviour, sleep changes somehow result from the impact of Alzheimer's on the brain. Many older adults without dementia also notice changes in their sleep, but these disturbances occur more frequently and tend to be more severe in Alzheimer's. There is evidence that sleep changes are more common in later stages of the disease, but some studies have also found them in early stages. Sleep changes in Alzheimer's may include difficulty sleeping. Many people with Alzheimer's wake up more often and stay awake longer during the night. Brainwave studies show decreases in both dreaming and non-dreaming sleep stages. Those who cannot sleep may wander but be unable to lie still or yell or call out, disrupting the sleep of their caregivers. Daytime napping and other shifts in the sleep-wake cycle. Individuals may feel very drowsy during the day and then be unable to sleep at night. They may become restless or agitated in the late afternoon or evening. An experience often called sundowning. Experts estimate that in the late stages of Alzheimer's, individuals may spend up to about 40% of their time in bed at night awake and with a significant part of their daytime sleeping. In extreme cases, people may have a complete reversal of the usual daytime wakefulness nighttime sleep pattern. Contributing medical factors. A person experiencing sleep disorders should have a thorough medical exam to identify any treatable illnesses that may contribute to the problem. Examples of the conditions that can make sleep problems worse include depression, restless leg syndrome, sleep apnea, For sleep changes due primarily to Alzheimer's disease, there are non-drug and drug approaches for treatment. Most experts in the National Institute of Health strongly encourage use of non-drug measures rather than medication. Studies have found that sleep medications generally do not improve overall sleep quality for older adults. Use of sleep medications is associated with a greater chance of falls and other risks that may outweigh the benefits of treatment. Non-drug treatment for sleep treatments. Changes. Non-drug treatments aim to improve sleep routine in the sleeping environment and reduce daytime napping. Non-drug coping strategies should also always be tried before medications, since some sleep medications can cause some serious effects. To create an inviting sleeping environment and promote rest for persons with Alzheimer's, here are some tips. Maintain regular times for meals and for going to bed and getting up. Seek morning sunlight exposure. Encourage regular daily exercise by no longer than 4 hours before bedtime. Avoid alcohol, caffeine, and nicotine. Treat any pain. If the person is taking a cholinesterase inhibitor, testosterone, or donazepam, galantamine, avoid giving the medication before bed. Make sure the bedroom temperature is comfortable. Provide night lights and security objects. If the person awakens, discourage staying in bed while awake. Use the bed for only sleep. Discourage watching television during periods of wakefulness. Medications for sleep changes. In some cases, non-drug approaches fail to work or the sleep changes are accompanied by disrupted nighttime behaviors. For those individuals who do require medication, experts recommend that treatment begin low and go slow. The risks of sleep-inducing medications for older people who are cognitively impaired are considerable. These include risks for falls and fractures, confusion, and a decline in the ability to care for oneself. But if sleep medication are used, an attempt should be made to discontinue them after a regular sleep has been established. The type of medication prescribed by a doctor is often influenced by behaviours that may accompany the sleep changes. The decision to use an antipsychotic drug should be considered with extreme caution. Examples of medications used to treat sleep changes include tricyclic antidepressants, benzodiazepines, sleeping pills, atypical antipsychotics such as risperidone, olanzapine, and quinidine, older classical antipsychotics such as haloperidol. Anytime you are prescribed a new medication, make sure your healthcare team is with you and ask you some of the questions, or you can ask these questions to them. What are the benefits of this medication? What are the risks of the medication? What other treatment options are available? Treatment goals are likely to change during your journey with Alzheimer's disease, but make sure you understand all the available options and the benefit and risk for each choice of your treatment plan as it evolves. Well, this quickly ends basically the treatment options for Alzheimer's. Give me the like for thumbs up for support, comment below. Feel free to subscribe to my channel if you haven't done so for more weekly daily updates. Don't forget to put the notification bell on because then you'll know what I'm up to. Don't forget to also, if you feel the need to, share these videos around. Follow me on my social media sites that's linked in the description below. Do what you love what you do. Until next time, thanks for support, thanks for watching, and I'll see you all again soon. Ciao.